So as we know, in the state of Maryland, physical therapy is a direct access profession. And at R2P, we see a lot of individuals, especially in the youth and adolescent range, that sustain an ankle injury or a foot injury over the weekend, during a game, during a tournament, and they end up coming into our clinic on Monday or Tuesday within 24 to 72 hours of that injury. Sometimes it's just because top of mind awareness, maybe they have familiarity with us and our company. We may have a relationship with that individual from a previous injury or a previous situation, and they just think of bringing them to us first. Other times, they may not be able to get into an urgent care or get into an orthopedic in a timely fashion, and they just want to get the ball rolling from a treatment and intervention standpoint. Now, when we have these foot and ankle injuries, we need to be mindful of if this individual requires or would benefit from imaging to rule out some sort of bony related injury, and really delineating, are we working with a potential fracture, or is this just an isolated soft tissue or ligamentous injury or sprain? So with this, we can utilize the Ottawa ankle rules to help us predict what the likelihood of presence of a fracture is, or a bony injury, and if there is a need to get medical imaging, because this may dictate what we are allowed to do with them in the early phases of rehab and what is best for the individual from a rest and recovery or activity modification standpoint. So as a reminder, with the Ottawa ankle rules, if they have any presence of pain at the medial or lateral ankle, and it's accompanied with either an inability to walk or bear weight on the limb, if they have point tenderness at the medial or lateral malleoli at distal 6 centimeters of each side, if they have any point tenderness at the base of the 5th metatarsal, or any point tenderness at the navicular. So point tenderness at one of those 4 sites, the inability to walk, and that's coupled with the presence of pain, would be indicators to refer them out for imaging to rule out the presence of fracture and figure out what the best plan of care is moving forward. With the Ottawa ankle rules in Kajabi, you should see a resource with a good picture and just diagram of what we just discussed. But keep in mind, direct access patients, foot ankle injuries, especially your ankle sprains, keep those rules in mind and make sure that you're putting yourself in a good position to make decisions and the patient in a good position to get the best care possible.